Hello, my name is Ada Taylor. I am a student at ECPI University online. I'm going to be speaking to you on my senior practicum project titled Repositioning Bedbound Patients, a staff in-service training. The focus of this video is to discuss my project goals and objectives, implementation of my project, application to practice, and the value to lifelong learning. Introduction of the project. Identify a need for improvement in repositioning techniques for bed-bound patients. Educate staff on the purpose of repositioning bed-bound patients. Demonstrate best practice for repositioning patients. Gather feedback through 10 questions survey. Repositioning bed-bound patients. Pressure ulcer definition. It is caused by prolonged contact or friction on specific points of the body, either by the individual's own weight or other mechanical surfaces, according to Cortes et al. 2021. Repositioning is moving a patient to a different position to relieve pressure ulcer on their body. That's Rowland et al. 2023. The importance of repositioning, according to Ablasi et al. 2022, is that it prevents pressure ulcers, relieves pain, improves circulation and comfort, decreases the risk of complications such as pneumonia and blood clots. The goal of this project was to design, implement, and evaluate a staff in-service on proper techniques for repositioning bed-bound patients, demonstrate best practice on repositioning patients, reinforce hospital policy on repositioning bed-bound patients to enhance compliance among staff, and number 4, to decrease the number of occurrences of pressure ulcers in bed-bound patients on the hospital unit. Project objectives. Number 1, construct a staff in-service education training on repositioning patients. 2, implement the educational in-service on repositioning patients to nursing staff for 2 weeks. 3, evaluate the effectiveness of the in-service training on repositioning patients. Completion of strategies. Research. For the literature used in this project, I researched 5 articles relating to my topic about repositioning bed-bound patients to use as evidence. I also researched my hospital policy and located the statistics for pressure ulcers on the unit. While I was not permitted to download the statistics, I wrote down the numbers to use in my training as evidence. I designed a PowerPoint presentation as a guide during the implementation phase and distributed paper copies as a visual aid for staff to follow along during the training session. I have posted a YouTube video training with PowerPoint presentation here. I made a video for staff to use as a refresher course. I also created a 10-question survey. The link is inserted. Specific outcomes for the nursing unit. My overall outcome for this project was to implement best practice techniques for repositioning patients to decrease the number of pressure ulcers, to increase compliance of best practice for repositioning patients, and to reinforce hospital policy. The facility where I work, CRMC, hospital policy number 11858 on pressure ulcer prevention and wound care states, patients who are unable to change position independently should be repositioned at least every 2 hours. That will include floating patients' heels. The registered nurse, licensed practical nurse, and certified nursing assistants are all responsible for repositioning patients. Understand that the purpose of the hospital policy is to guide the practice within the facility. Evaluation of the process of the project. During the preparation phase, I discovered that preparing a lesson plan for professional individuals was very challenging because I had to find information that would be impactful to their practice and something that would pique their interest. During the implementation phase, I conducted multiple in-service training sessions with large and small groups. However, the smaller group sessions proved to be more successful. I also did some hands-on demonstrations with staff, showing them proper techniques for repositioning and proper use of pressure redistributing mattress. And I had the staff return the demonstration. The challenge I faced during this time was that it was very time-consuming. As for the evaluation phase, I analyzed data collected from the training, including the 10-question quiz and verbal feedback. The hands-on demonstration proved to be the most successful, most effective training method because the staff were able to return the demonstration perfectly. The 10-question quiz, it gave me a measurable data to assess the staff understanding of the information and the effectiveness of the training. The hospital survey on pressure ulcer on this screen showed the decline in pressure ulcer within a 3 weeks time frame of the project. We have 30 patients on the unit, 30 patients on the unit. 9 of those had pressure ulcers. Within the first 2 weeks, the pressure ulcer had declined. Within the first 2 weeks of the training, the pressure ulcer had declined to 7, and in week 3, it had declined to 4. The graph down here analyzed the results from the 10-question quiz, which shows that out of 123 participants, majority understood the information presented. Application of the project in practice. The application of the project in practice is to improve patient outcomes on pressure ulcers and for staff to utilize best practices for repositioning patients. Evidence-based practice stated that the frequency in repositioning bedbound patients can decrease pressure ulcer risk. The supportive evidence that I have is that according to Cortez et al. 2021, the standard recommendation for repositioning is every 2 hours. However, the frequency can be adjusted to every 3, 4, or 6 hours based on the patient's condition. The value of the project to the students' lifelong learning. This project has been an excellent experience for me because it has strengthened my desire for professional growth. It has motivated me to want to engage in future training and quality improvement projects, and it has enhanced my ability to make informed decisions in complex healthcare situations. For future training, I hope that facilities will provide future training for healthcare professionals on evidence-based practices. It is my desire that more training should be made available to healthcare professionals on best practices for their skills that they perform on the job, and that staff will utilize knowledge gained from this training to enhance the care provided to the patients. Thank you.